Good morning, everybody. Happy to be here. My name is Harvey. I'm the training officer here at Folkestone and Hythe District Council. I'm also part of the Revenues and Benefits team, and this is where mainly Lift has been pulled into as far as our council is concerned. Just a bit of information about our district. We're down here on the south coast. We've got approximately 52,000 dwellings. Our CTR caseload has gone up this year. We're currently running at about 10,000 claimants, and that's gone up 8,000. Sorry, it got up from 8,000, 2,000 extra from early 2020. So that was an increase of about 500 per month we were doing during the first lockdown. Our housing benefit caseload is about 5,000. That's slightly lower actually than this time last year, as more and more claimants move over to universal credit. We are approximately 60-40 working age to pension age, so we've got a more elderly population, higher care needs, and less likely to pay maximum council tax moving forward. We're mostly a rural district where we have millionaires and the odd billionaire, but we also have two big towns where deprivation is highest, and we are in fact the second highest deprivation in Kent currently. We've had the Lift dashboard since July 2019, and this year is probably the year where we really got a good grip on it and started doing a lot more work with it. Thanks, Janet. Yeah, what a year. Who would have thought this would all happen in 2020? Even with that going on, we still managed to do a few campaigns with the Lift dashboard. And I'm going to talk through each of those 5 ones: the pension credits for over 75s, self-employed and low incomes. This mainly came out because of COVID. Again, those most affected by COVID, severe disability premium because the gateway was shutting, and also targeting discretionary housing payments. We have been building up for this. As Zoe was saying earlier, there wasn't a brilliant financial situation for the country before COVID, and we were looking at ways of being of helping our customers more through vulnerability and welfare. So we started up building up a welfare team. We started 2020 with 2 members. We've now got 5. Luckily, we had gone up to 4 people before February. So we had no idea how busy they would be, and they have been busy. So we just been really building up, and I think we're at a stage now where we're actually really getting to work on those who need the most help. Yeah, thanks, Janet. Yeah, so the first campaign that we did was pension credits for over 75s. Following the Lift focus session at the end of last year with policy and practice, there was a commitment on most of the parties that were there that we would all work together on one, effectively a national campaign, to try and help as many people as possible to get their pension credits. And this was going to be linked in with the TV licensing as well, because they were going to lose their free TV licenses. So in our area, Lift identified 88 households that would be eligible for pension credits. These were contacted via outbound calling. If they weren't there, a message was left if possible, and if no contact was available, then a letter was sent to them. We had really good outcomes on that one. 27 of those 88 households are now claiming pension credits, so it's about a 30% success rate, just on the back of a few phone calls and a few letters. So yeah, really good. Thanks, Janet. Yeah, and then we moved on to self-employed and low incomes, but COVID hit. We went through huge changes as a council. I'm sure everybody here has gone through huge changes. Our CTR, as I said, went up massively. We had to set up and allocate £150 to all working age CTR claimants. We had to have additional hardship payments for those who weren't able to claim CTR, and targeted those that were most COVID related. So those had really lost incomes. We've also had to arrange and administer the £500 track and trace payments. And we've also, during lockdown, we've reallocated resources so that visiting officers contacted those Lift identified as being self-employed as well as families on low incomes. So we basically moved them from being visiting officers, lockdown, couldn't visit, to then making the calls in order to help people maximise their income whilst everything was going wrong in April and May time. As they were visiting officers, they knew particular areas very well. That we split the groups down into wards to make it a bit easier for them and to make the numbers a bit more manageable. So they weren't doing too many. Okay, thanks, Janet. Brilliant. Yeah, and then our third one was those most affected by COVID. In the summer, it did calm down a little bit, so we just needed to, we took a bit of time, and we had another look about those people that we wanted to target and wanted to really help. And we realised that while the £150 for all working age council tax reduction claimants worked well, as it had to be rolled out quickly, we needed to do a more targeted approach, because in reality, people got 150 quid for not doing very much. So those that were unemployed before COVID were still unemployed. They got £150 and their circumstances have not changed. In fact, their circumstances increased because of universal credit uplift and things like that, and higher local housing allowance or upscales and things. And we use Lift to identify those who weren't either in the data set or were working in January 2020, but then were not in work in September 2020. So basically, those are people who were on high incomes relatively, or not in the data set, to those that were suddenly in the data set and not in work by September 2020. So those incomes that had dropped, and more importantly, those that were new to the benefit system. Zoe's just had a quick talk about that one earlier, about people who are not experienced and not used to moving around the benefit system. Looking at all those in our area, we had just over 1,200 households, far too many to contact individually. So we used Lift to look at the financial resilience to break down to a more manageable figure. Those that were in crisis, because there's a struggling, at risk, in crisis and coping. So those were in crisis, they needed our help straight away. So we managed to identify 46 households in our area, and they were all contacted to try and maximise their income and get what they were, if possible, get what best we can do for them. Try to claim as much as they can. Okay. Thanks, Jenny. Yeah, we've got a happy story here. We've got a couple with a 3-year-old daughter, and there's another one on the way. Mr. had lost his job with the local holiday company. They owed £1,600 worth of council tax over this last year and the year before that. They weren't even able to afford one Christmas present for their 3-year-old daughter. Unfortunately, by the time that we managed to get in contact with them, we weren't there in order to get a Christmas present for the 3-year-old, but we were able to clear the family's outstanding debt. So they started 2021 in a much better financial position. In fact, they don't owe anything to us at all at the moment. So that's really helped them out. The best part is we were in time to contact the local arm of Baby Basics, who have provided a Moses basket full of clothing, toiletries, nappies and essential equipment. And I've only just found out yesterday, actually, babies arrived, and we've also referred them to the Warm Homes grant as well. So really, hopefully, turning that family around and making a real difference for them moving forward. Yeah, thanks, Jenny. Once we'd had a look at that, we also had a look at severe disability premiums. As a lot of us know, the gateway to severe disability premiums has now closed. We want to get as many people on that before they had to go onto universal credit. We ran the campaign twice last year. There were relatively small numbers for our area, and it was a quick fix basically before the legislation changed in January. So trying to get a maximum number of people on there before the rules changed. We're looking forward to getting some results from that soon, actually, because it's a fairly new campaign. Thanks, Janet. And the final one that we did this year, apologies for the brief discussion. So the discretionary housing payments that we were using were generally for rent top-ups, deposits, moving costs, and first month's rent, etc. We haven't had as many tenants moving this year. Landlords have been unable to evict, tenants have stopped paying, so rent balances have been increasing. So we were looking a way of using our budget as much as we could. We realised in autumn that we had a fair amount of discretionary housing payment budget left, and we used Lift to target those who should be eligible for discretionary housing payments. Again, we split them into more manageable figures, more manageable numbers. So 3 groups of tenants: council, social and private. And in November, just to give you an idea of where we worked, we had 26 applications for DHP with 22 awarded. And then we started the campaign, and then in December we had 72 applications with 62 awarded. So obviously, our numbers reflect that the campaign did have an effect, and with hopefully maximising other people's income for discretionary payments. Those that also apply for DHPs were automatically referred to financial support payments as well, to help those with their council tax. So that was really good as well. So they were automatically included in the people that we would look at. Okay. Thanks, Janet. What's next for us? Well, as Zoe said, lots of challenges. Furlough will end at some point this year. So more benefit claimants are expected, and more people who are not new to the system. What we're hopefully going to use Lift for is to focus on those most affected, those new to benefits, those with council tax and overpayment and rent arrears, and those whose financial resilience is at risk or in crisis. So those that really need our help. So we're able to maximise the support able to them. We're hopefully going to move the discretionary housing payment referrals from Lift into business as usual, so that every month we will get a new list, and then that will be worked through and looked at, and the customers contacted. And on a more strategic side, we are hopefully linking up with Kent County Council and other districts of Kent to add more data to the dashboard to give us a really good picture about where our customers are and what difficulties they may be facing. So thanks very much for that.